have proper PPE. I have my equipment for a patient who is having difficulty breathing. So I have my oxygen tank, non-rebreather mask with tubing, my regulator, and a wrench to open my oxygen tank. So I'm gonna get my oxygen tank ready by cracking the valve. Okay, so proper airflow in the tank. I'm gonna apply my regulator. I'm gonna go ahead and open my oxygen tank. And as I'm doing this, I'm listening for leaks, so checking for leaks and also checking to see that there is a good amount of oxygen there. So 2000 PSI. I'm gonna attach my non-rebreather mask. And I'm gonna set my regulator to at least 15 liters per minute. I'm gonna pre-fill my reservoir bag, oxygen. I'm gonna put it on my patient and make sure it's a nice snug fit. Okay, so proper PPE. So we seen safe?
Seen is safe.
Okay. Hey, are you okay? Are you okay?
No response.
No response. I'm gonna go ahead and request additional ALS, and I'm gonna check pulse and breathing.
So the patient is unresponsive, apneic, and has a weak pulse of 60.
Okay, so I'm gonna go ahead and manually open the airway using the head to chin lift. So how does my airway look?
The mouth is full of secretions and vomit.
Okay, so I'm gonna go ahead and suction. I'm gonna get my suction device, and I'm gonna get a rigid suction catheter. I'm gonna go ahead and measure it from the tip of the earlobe to the corner of the mouth. That would be as far as I could go. We would turn on our suction. Okay. As I'm inserting, I am not covering the hole. So I'm going in and I'm suctioning on the way out using a sweeping motion.
All right, and the mouth and oropharynx are now clear.
Okay, awesome. So I'm going to go ahead and insert an OPA, so an oropharyngeal airway adjunct. And I'm going to measure this from the tip of the earlobe to the corner of the mouth. So this is the appropriate size. I'm going to go in at a corner, 90-degree flip, and that should maintain the airway open.
No gag reflex is present, and the patient accepts the adjunct.
Okay, so I'm going to go ahead and start assisted ventilations using a BVM attached to supplemental oxygen at 15 liters per minute. So oxygen is set at 15. Maintaining that airway open. Now we're gonna give ventilations 1 every 6 seconds.
Okay, so ventilations is being properly performed without difficulty.
Okay, so I'm gonna go ahead and recheck for a pulse.
Patient is still apneic and has a weak pulse.
Okay, so I'm gonna continue giving ventilations and on the way to transport, so I'm transporting immediately.
And how do you know if you are delivering appropriate volumes with each ventilation?
So I see proper chest rise and fall on the patient.